This is the skill assessment, culture, and sensitivity. First, you will assemble and prepare your supplies needed for the lab. You'll have 2 culture tubes, one for aerobic, one for anaerobic. You'll have a specimen container for tissue culture, a biohazardous labeled plastic bag for transport of specimens, and 3 specimen labels. To perform the procedure, we're going to identify the site that's going to be cultured, and that site is going to be the left lower abdomen. After we identify our site, we're going to remove any excess tissue before the culture is taken. Clean off our rongeur, that is dirty tissue, so I'm going to place this over here in the corner. After I have removed excess debris, I'm going to get my culture swab. Note that the culture swab and culture container can be opened directly onto your table, or your circulator can pass it to you, present the tube to you sterilely, and you will grab it from them sterilely. But since I had to open my supplies beforehand, it's in my basin here, and we want to make sure it's clean. When you grab your culture swab, you want to grab it by the top. You never want to touch the swab portion. Okay? Once you've grabbed your swab, you're going to then swab as close to the actual wound tissue as possible, being careful not to swab any surrounding wound edges, okay, or the skin, because we're trying to culture. We're going to swab approximately 1 centimeter of the wound, rotating the swab while making a zigzag pattern across the wound. Remember, don't touch any of the skin, just the wound. Zigzag pattern. Once you retrieve your culture, you then are going to place it in the culture tube. Again, not touching the swab or inside the tube. Place inside, break off the stick, place the cap. Right away, you're going to put a number 1 on your culture swab tube, because you would take 2 of these. So you write number 1. Then you're going to get the specimen name from the surgeon. You're going to ask the surgeon the specimen name, and since I am the surgeon today, I am going to say this is the left lower abdominal cyst, and then you write it down right away so you don't forget. Left lower abdominal cyst. And you're going to write number 1 because cultures go in order. Your second would be taken. That was your aerobic. Then you would take your anaerobic. You would perform the same procedure. Besides putting 1, you're going to put number 2. It's going to be the same specimen name. Left lower abdominal cyst. After your second culture is done, you then are going to retrieve some cyst tissue, because surgeons love more than 1 specimen. Okay, so I take my top off right away. Okay, gonna dig around some tissue in the cyst. It's a nice piece. Place inside my container. Put the cover on. Confirm with the surgeon the specimen name. The specimen name is going to be left lower abdominal cyst tissue. And you're going to write it down so you don't forget. And always double confirm. Cyst, and my pen is dying. Tissue. And this is going to be my number 2, because I have 2 specimens. Once you have retrieved your specimens Ask the surgeon if it's okay, if you can pass them off. If it's okay to pass them off, you then pass them to your circulator. Before you pass them to your circulator, she has made a slip with the patient's name, the date of birth, the specimen name. And then also, you have to put the date and the time. And this time is going to be 2:30 for the specimen. Okay, when you pass off your specimen to your circulator, you're going to confirm the sticker with the patient's name, date of birth, specimen name, left lower abdominal cyst, confirm that it's stat for gram stain, the time it was taken, and the date. Once you have confirmed, you will then pass it to your circulator sterilely. This is me passing it to my circulator sterilely. This is my circulator's hand. She's going to put this, they are going to put the sticker on. Once they place the sticker, they are going to then put it in the bag for transport. That's specimen number 1. Specimen number 2 is our tissue. Here's your slip. For example purposes, I only made 1. Jane Smith, date of birth. Specimen name, left lower abdominal cyst tissue, this would be called. Does not need to go as aerobic or for a stat gram stain. It was taken on 7/18, and the time will be at 2:35 instead of 2:30. Then once you have confirmed the specimen label, you pass it to your circulator. The circulator will put the label on the specimen. They will then put it inside the bag, and then the specimens will be sent down to the lab.